Fertility is 25% of my practice, and would you believe that most women come to me for fertility and they're actually in perimenopause? And did you know that you can still get pregnant when you're in perimenopause? My name's Dr. Gabrielle Francis, and welcome to my series, Empowered Menopause. On this episode, we're going to talk about fertility and perimenopause and what you can do to enhance it and some of the little tweaks you might have to make, but it can be done. Welcome, and let's go. Now I'm going to talk about perimenopause and fertility. 25% of my practice is fertility, and believe it or not, most of those patients are in perimenopause or the 10 years before menopause. And for many of these women, they can still get pregnant. It may be a little bit more difficult, but a lot of them can still get pregnant, especially in those earlier years. And so what do we look at? What are some of the things that may be causing some of the difficulties for women during this time? First of all, the egg number might be dwindling a little bit, and that can be seen by looking at your FSH, LH, and the AMH. Sometimes the egg quality is going down just because of the exposure of time and toxins to those eggs. The other thing is that often women are very low in progesterone. Most women are low in progesterone after the age of 35. And so even though they could be getting pregnant every month, it may not be implanting. Another common thing that I see is that often a woman's uterus is tilted or out of alignment. So every month, instead of all that old blood cleaning out, a lot of times it's folded forward, anteflexed, or folded backward, retroflexed, and that blood gets stuck up in there. And if that blood's stuck up in there, it's not a good lining for implantation for the baby. So something that I do to help women with that is something called the Mayan abdominal massage, which is a realignment of the uterus and the ovaries. So when a woman's in perimenopause and she comes to me for fertility, I do a complete workup of all of her blood, check her hormone levels, check her thyroid and her adrenals, and try to get her in as much balance as possible. Sometimes we have to help improve the quality of the egg with different nutritional things. Often we have to help detox her body to create an organic garden for the baby, and that can often help to improve the egg quality. We often have to use some progesterone cream. Some women have to use fertility treatments, and I support them on that kind of journey of fertility treatments, but I still want to try to help get her body as healthy as possible and do everything we can naturally to improve the outcome of those treatments. It's important to know that this is the garden the little baby's going to be growing in. We want that garden to be organic and not full of any toxins. Secondly, we want to improve her egg quality, and we can do that with different nutritional supplements and herbs. And then we want to keep her hormones in balance, and do that. Sometimes the doctors will use medications, estrogens, progesterones, and sometimes you can do it using herbs. And often we have to do the uterus treatment, which is the Mayan abdominal massage, to correct the uterine alignment. So to break it down again is that most women are still fertile, especially in their early stages of perimenopause. It just might take a little extra work, but it can be done, sometimes alone and sometimes with the support of medical clinics.